certified plastic surgeon, and today we're going to be demonstrating the Zeltique CoolSculpting device on one of our techs here. This is Renee. Say hi, Renee. Hi. And we're going to be working on Renee's lower abdomen right here. For those of you that don't know, the CoolSculpting device involves cryolipolysis. So it's basically a machine that allows us to freeze the fat. That fat ends up dying, and over the course of about 3 to 6 weeks, you're going to notice a change in the lower abdominal area, basically without surgery. It's also fairly comfortable. There's no incisions, no needles, no numbing involved. Basically, the machine just drops the temperature of the skin and the fat to that area to a level at which the fat is programmed to basically die. Your body reabsorbs that fat, and there's no downtime associated with the procedure itself. Now, Renee, what were your motivations in terms of getting the procedure done?
Well, I work out quite a bit, and I've been doing a lot of abs, and I'm still seeing that I have like a roll here, and then also I have my love handles. So whenever I wear my jeans, I want to be able to have pretty much kind of a flat area there instead of an overhang.
All right. So why don't we take a look at your lower abdomen here, if that's okay with you. Drop it down just a little bit. So as you can see, she's already marked out. So basically, hello Larry. So basically what we're doing is we basically mark out the area of greatest projection. For herself, it's the area underneath the belly button that's of biggest concern. So what we'll do is we'll apply the liner and the device to this particular area. It'll stay on for about 1 hour while it's working, and that's basically it. So Renee can watch TV, watch a movie on the iPad, read a book, do whatever she needs to do during the actual procedure itself. In order to do the love handles as well, it's the same procedure, but it's going to involve an additional 1 hour for each side. So a total of 3 hours here in the office, but for today we're just going to demonstrate the lower abdomen. So basically what we're doing is, in order for the cooling device to work appropriately, we have to apply a little bit of a gel pad. So there's a little bit of a protective pad that we just lay right onto the tummy, kind of centered right onto the area that we're working on.
It's cold.
A little chilly. Basically smooth that out, make sure that there's good adherence to the skin. Basically line up the machine with the area in which we're going to be working. So it's good. I think we've got good suction. I don't know if you're able to see that through the lens of the camera, but you can see that her skin and fat has been sucked into the machine itself. These are the cooling units right here, so the amount of skin and fat that's between these two quarters of the unit will basically be frozen. So basically, start the unit. Just like that.
So what I'm feeling is like a pulling and tugging.
Hold on to this just for a second. And just use this to support it in position. So is there a lot of discomfort when you're feeling the machine working?
It has a little bit of pain, but it's like you've got your finger stuck in something, or part of your skin is kind of stuck into like a door or something.
Okay, so it feels cold and it feels some pressure from the suction.
Right.
The machine itself is very, very smart. It's an hour-long treatment, and it basically will tell you exactly when it's going to be done. So basically, Renee can just kind of kick back here for a little bit and watch a little bit of television or or read a book while the unit works. There's a pager that we have that will notify us if there's any issues, if we step out of the room. There's also a patient call button, so if there's any problems, you can always give us a page. So we'll see you back in about an hour.
All right,
Okay.
thank you.
Okay, Renee, we're 26 minutes left. How you feeling?
That went okay. The first like 12 minutes or so were a little kind of intense, but now it feels just kind of cold and numb, and it's actually not uncomfortable anymore.
Good. Think you can last 25 more minutes?
Oh, sure.
All right. Go.
Okay, so we're done now with the 1 hour session with the CoolSculpting device. How was that, Renee?
It wasn't bad. The first 12 minutes were a little intense, and then after that, it was perfectly fine.
I think that's what most patients experience, about 8 to 10 minutes. A little bit of discomfort from the pressure, from the cooling, but after that you become really numb, you really don't feel anything, you just kind of sit back and relax while the machine does its thing. So now that we're all done, I'm going to have you support the device here. Take off this pillow. Turn off suction.
Inside.
Basically lift and release that suction.
On this side, too. All the way up inside.
You okay there?
Uh-huh.
Alright. So again, this is that contact gel pad that we use. So basically what you're seeing is that skin and the fat underneath that's been cooled down, and you can see it's kind of in that oblong shape. And what we'll do is we'll massage this area to kind of promote the breakup of some of that fat underneath there. Is that a little bit sore when I do that?
It's a little sore.
A little sore. It's pretty cold. I mean, it's ice cold here. But that's basically the procedure. So very straightforward. Just kind of kick back for an hour while it's done. And she should notice results as early as 3 weeks. And they'll last for basically a lifetime, very long-lasting results. With maximal results typically noted around 2 to 3